Good evening, everyone. Thanks so much for joining for our town hall tonight on reproductive freedom and birth justice. My name is Shekhar Krishnan. I'm running for city council here in Jackson Heights and Elmhurst, Queens. And I'm so excited about tonight's panel as well. We have two powerhouses who are doing such incredible work on the front lines of fighting for reproductive justice and birth justice in our city. And these are issues that are so pressing for communities like ours here in Jackson Heights and Elmhurst, because when you think about both abortion access, reproductive care, when you think about maternal care in our city, we know firsthand that there is a huge racial disparity when it comes to these services. Let's start with abortion, for example. Abortion as a protected fundamental right in the city on paper doesn't mean you have access to abortion services and reproductive services in reality. And that particularly hits especially communities like ours and local communities of color across our city, where abortion must be safe and free, as all reproductive services should be. But the reality is that's not always the case. And that's exactly the point of reproductive justice, is to think about these issues through the lens of not just issues of gender, but also the intersection of gender and race, and how that can actually undermine and in some ways erase the rights you may have on paper, because in reality, you may not have access to them. And that's as much a fight here in the United States as it is globally too. We also think about maternal health and perinatal health, not just after birth, but also during pregnancy as well, and before too. When it comes to maternal health care and maternal health services, we know that there are extraordinary racial disparities as well. You have to look no further than maternal mortality rates to know how much Black women in particular are dying through childbirth at much higher rates than all other women too. And in fact, the racial disparities when it comes to maternal mortality in New York City are far higher than the racial disparities at the national average, which tells you how much needs to be done in our city to address these issues. And these are issues that span everything from maternal health itself to medical health and medical racism when you walk into a hospital, to healthcare and the access to who has healthcare, who has insurance in a state where we still do not have universal healthcare, even though that is so urgent. We know that even right here at Elmhurst Hospital, a public safety net hospital that has only less than one bed for every 1,000 patients that come through these doors, that was overwhelmed during the pandemic, but gets less in public funding, public dollars, than any other private healthcare institution in our city. It just tells you the deep inequities when it comes to healthcare in our city and how that impacts so much both reproductive freedom and maternal health. And that's why I'm so proud today to have two women who are on the front lines of this work, who every day are fighting in particular for Black and brown women whose voices are not heard and who aren't seen when it comes to reproductive health and maternal health in our city and frankly across the world too. I'm so glad to have Chanel Portia Albert with us, the founder of Ancient Song Doula Services, that is really the organization in New York State that has led the fight for community-based doula services to address racial disparities when it comes to maternal health and to provide maternal health care services, especially for Black and brown communities across our city in Brooklyn. And we're going to talk tonight too about their expanding work into Queens right here in Jackson Heights and Elmhurst as well. I'm so proud to have with us too Paula Avila Guyan, who's the executive director of the Women's Equality Center, which has done incredible work both here in the United States, but especially across Latin America, fighting for abortion, fighting for reproductive health, and most recently leading the very successful campaign in Argentina, and which we'll talk about tonight too. So thank you so much for joining us, both of you. It's really an honor to have you both here. And I would also add to both Paula and Chanel, their work and their organization's work have really inspired our family justice platform that we have. So if you go to our website and check out www.voteshaker.com, we have a specific, for me, as a parent, a parent of two small children myself, and seeing and firsthand as a husband, as a parent, as a father, and especially as a father of color, these issues up close to through when our children were born over the last 5 years as well. And knowing how the fight for housing justice in our city, I always say where your home is affects everything else around you, connects to all of these different issues, whether it's healthcare, whether it's maternal health, whether it's our schools and childcare. Knowing these issues and seeing them, these are such central personal fights for me that I care deeply about. So definitely check out our Family Justice platform, and thank you both for your work that's inspired my advocacy too. But without further ado, let's get started. Chanel, maybe we'll get started with you first. Can you talk to us about when we talk about the racial disparities when it comes to maternal health, maternal mortality in our city? What are we talking about here, and how have we reached this point where Black women in particular, and Black and brown women overall, are facing such racism and racially disparate care and especially mothers here in New York City? How do we get to this point?
Well, so, just to give some context, in New York City, Black women are 8 to 12 times more likely to die or suffer from a childbirth-related pregnancy complication, just in accessing services, right? And so what we've noticed is the intersections, right, of what does it mean to be Black, what does it mean to show up as a woman, but then what does it mean to understand that regardless of socioeconomic status, regardless of education level, regardless of where you are, you fare still worse than our white counterparts. And so what we realize is that then the ultimate problem is in this racism, right? And an implicit bias in the ways in which it shows up within our U.S. healthcare infrastructure, given the historical context and the ways in which Black bodies have been used to advance sciences, given the ways in which, if we start to think about the enslavement of African women here in the United States, and we look at, Dr. J. Marion Sims, and, considered to be the father of gynecology, and the ways in which he used, the advancements in gynecology, but on Black bodies that were considered to be less than, right? And, the perpetuation of these stereotypes, such as like, Black and brown people don't feel pain the same way. We have a higher, pain threshold. The narratives of, we're aggressive, or we're only seeking out, when we present ourselves in the ER, oh, they just want pain medication, right? Like there's some kind of substance uses that's going on. But then when you top that, on top of that, where you have language barriers, right? When you have right, cultural barriers, religious beliefs, then it also becomes more compounded, right? So then you have these situations where, people are going into spaces, they're going for, they're seeking out a particular kind of care, and we're not meeting people where they are. It's really becomes an issue of human rights within the birth room, and really centering bodily autonomy and what the birthing person wants for themselves and for their families. Understanding that, birth is not a one-time event. We like to think of it as that, but it has a ripple effect. And it's typically a community event. How we choose to center birthing people, has a lasting effect on how they're able to parent their children. And in New York, we've fallen really short on that, and really being able to set up ways for individuals to feel centered within their birthing experience, having access to different avenues to be able to do that, such as like, we only have one birthing center left in New York City. When at one point we had 5. Right. And then there was 2, and then the last one that was in Brooklyn just recently closed. And so now the only one we have left is the one in Manhattan. And then there's a shortage. Yeah. There's a shortage of home birth midwives, so if someone wants something outside of just going to a hospital-based institution, those options become very limited and very slim. And so it's really about, being able to bring access options that are culturally congruent, that allow for someone to express their full bodily autonomy in their birthing experience, but also have the necessary supports in place afterwards, right? Like, it's like, oh yeah, we're going to put all this emphasis on, the perinatal period and when you give birth. But then it's like, after you give birth, it's like, all right, see you later. So what does it mean to have the necessary supports in place during the postpartum period?
And I'm so a couple points is you so powerfully connected all of these issues together, talking about race. I mean, I'm also just shocked to know that the only freestanding birthing center there's only one left, and it's in Manhattan of all places too, which really says a lot also about how these inequities get exacerbated. But you're absolutely right too, the way in which it's not just perinatal care, it's also postpartum care. And, I myself was shocked to see too, after our children were born too, with my wife Zoe, just the way in which the doctor's appointments there's probably one or two after, and even then it's a quick checkup weeks after, or so anything could have happened during that time, and you're on your own to figure those things out, and how much that's magnified the potential for harm, and especially for women of color too. It's particularly shocking in the postpartum period. So my question for you is also, what is the work of Ancient Song Doula Services? When you talk about all the problems here, you're on the front lines of this work. Can you talk a little bit about the work of your organization that you founded, and also what its mission is to address these issues, from medical racism to perinatal services to postpartum and to community-based doula services?
Yeah, so our work is centered on, really being able to meet people where they are, not where we expect them to be, and center women of color, low income individuals, and those who are undocumented, right? So what does it mean for folks to be able to access care and services in a way that centers their whole person, right? Like, because what does it mean for us to show up as our full selves, and be able to do that in a safe way? So regardless of, again, gender, race, religion, being able to understand that you can get someone, a physician or a midwife who looks like you, someone who speaks your language, right? Someone who is based within your community, who is centering the things, who understands you, right? Our work is, also focused on really reducing the maternal mortality or eliminating the maternal mortality, right? What does it mean to have the infrastructure in place where accountability measures are met? Currently, right now in New York City, there's no way to hold anyone really accountable if they, are doing bodily harm to someone. And it's really hard for someone to bring a case up against an institution. There's been examples like Shaija Washington, right, who died of a pregnancy-related complication. You have Amber Rose Isaac. You have countless others, Shamani, who, some of the situations were based on racism, or medical racism, and then other situations were just based on like not listening to the person, not following up, not having the proper protocols and policies in place to really be able to center birthing people within New York City. And so, a lot of our work has centered around advocacy. What does it mean to do that? What does it mean to uplift the voices and the human rights of individuals when they walk into a space? But then also, like, build up workforce, right? So, we train people who live and work in their communities to support their communities, right? To be able to go on to, either work independently, work for an organization, or, a lot of the folks that we've trained have gone on to work, do work in terms of data and research and all other things. But essentially, the core focus is to center hope, and we do a lot of that, last year with the pandemic. And since then, we've been doing mutual aid. So like giving about 50 to 70 boxes of groceries away every single month, giving away diapers and wipes, formula, breast pumps, all these things. Understanding like, it's just not about somebody just being furloughed or unemployed. It's like, what does it mean to meet their needs in between things, right? Maybe you're on social services, maybe you can't get access to something. You know what I mean? So really wanting to center community in a way that is affirming to them. And so we value community. We value community as active stakeholders and really want to get to know them. So like being in Queens is a great opportunity to get to know. I was there all day yesterday. I got to eat some amazing, I had like some Thai food. I had I had some really good Colombian food. And like, the doctor who was showing me around, Sheila, she's like, listen, next time we're gonna go get some good, Indian food. I'm like, listen, I'm down. You know what I mean? Because everything happens over a good meal, good conversation. And that's how we can connect community, right? Being able to like really talk and be able to share stories and listen to people. and find out what do you need? You know what I mean? So instead of us making assumptions as an organization saying, oh yeah, they need this, it's like, no, how can you become involved, and you tell us what it is you need and how we can best support you in that process. So our work is really grounded in that and really wanting to center individuals.
Exactly. That's great to hear too. And I also want to get back to what you mentioned about Queens in a second too. And let me just also want to talk to Paula quickly for a second too, is about, we've talked about the struggles, particularly of birthing people of color, but also a big part of that is the choice itself. And how do we protect the right and the right to have a choice, not just on paper, but in reality, and for women in our city and across our country too. Can you talk a bit about your work, Paula, at the Women's Equality Center, and in particular, the historic campaign that you all led in Argentina, and what lessons we could draw from that about reproductive freedom here in the United States?
Thank you, Shaker. And before I go into that question, I actually want to share a little bit of what, when Chanel was talking, there were so many things that would resonate in my heart. I actually just gave birth 7 months ago. And one of the biggest surprises when I was in the process was to find out there is no place to give birth in Western Queens. Like I had to go either very deep into Queens or into Manhattan. And just the fact that I thought I live in a place, I mean, I am originally from Colombia, where normally you don't have places to give birth close to you. But I was supposed to be in New York City, where I should have everything accessible. I mean, how is possible that for me it was hard to find a place where I could give birth? And I was also terrified of giving birth as a person who speaks English as a second language. And maybe I was in the middle of COVID and I wasn't sure if I was going to be able to have my husband there. So I needed to advocate by myself. So I really appreciate everything that you do, Chanel. After having passed through such experience, at the end, everything worked out and I have a beautiful boy.
And really cute.
I know the feeling, but I also experienced my maternity and my birth experience in a beautiful way because it was my choice. Because I decided very intentionally to become a mother, and that is not the situation of many women and girls in many places in the United States and in Latin America, and that's one of the reasons why I do the work that I do. So a lot of what we do is support the work of organizations like Chanel. They are on the front lines, they are on the base in many countries, from Argentina to here, in all the hemisphere. They are trying to get their work done, are trying to get the work known by everybody, so the people can go and seek services. And in many of the cases in the countries that I work with, that is not possible because there is no even a right. So in Latin America, just to give you a brief context, there are 5 countries that have a total abortion ban. When I mean a total abortion ban, it means the type of bans that actually pass today in Texas, bans that, or even worse than that, bans that will not even allow you to access abortion, to even save your own life. Let's just say that you find out that you are pregnant at the same time that you find out that you have cancer. They might deny you cancer treatment because you're pregnant, and that might hurt the fetus. Those are the type of situation that many women and girls confront in Latin America, and the cases that we are fighting for. There are 5 countries that have that. There is El Salvador, Honduras, Nicaragua, Dominican Republic, and Haiti. Then in the rest of the region, there are other countries that have access to limited circumstances. You need to justify the reason why you want to have an abortion. The majority are related to life and health. Many few are related to rape. And then there is only Argentina, Uruguay, and Cuba. They are the countries that allow you to have abortion based on your choice, best because the women decide that that's what she wants to do for herself. So it's a very hard situation, but similar to the United States, it doesn't affect us all equally. In the same sense that in the United States, race is a big component, I also think the class is a big component, economic status is a big component, and the same thing is in Latin America. We have the expression that says, las ricas abortan, las pobres se mueren. Rich women have abortion, poor women die. And that is just a very strong reality of the reasons why we talk also about reproductive justice. Because at the end of the day, women who have means will always be able to pay somebody, find a way, travel to another country, travel to another state, and find a doctor, a private doctor that's willing to provide the services that they deserve. But for women who live in rural areas, women who are no have the agency to advocate for themselves, who have not been taught the choice is something that matters, and they have a choice because the system has oppressed them for too long, are the women who end up dying. Because at the end of the day, when a woman decides not to have a pregnancy, when decides that that's not what she wants, she's going to do whatever it takes, and in the majority of the cases, those are unsafe choices, and that is just really, really sad. And I think the other component of it, in the same way that we want to feel women supported in every level when they are deciding to give birth, we also want women to feel supported in every level when they decide that that is not right for them and they want to terminate a pregnancy. So I think that as far as we feel sometimes that the work in Latin America is not the same in the United States, at the end of the day, I think that we are talking about just supporting women, especially women of color, especially women who are in vulnerable situations, especially women who are living in poverty or have been outsourced for many multiple reasons, to be able to live their lives that they want to live, and that they are able to feel supported in whatever choice they feel that that's what is right for them.
And to your point, the struggles mirror each other, right? Because right here in the US too, no matter what it says as far as the Constitution goes and protecting the right to have an abortion, when all these states like Texas and others and Arkansas are passing all of these, Louisiana, sorry, are passing all of these bans, what it really means is that poor women, and especially poor women of color, are the ones affected. Because like you said, when you're rich or wealthy, you'll find other means to go to other states to get an abortion when you want it. But it's poor women in particular who are not going to have access. And so those struggles mirror each other, as you said very effectively, in Latin America, as much as they do here too. Whether you have the right on paper or whether you don't, right? It's the same thing. Chanel, to go back to you for a bit too, one thing you were talking about, and just kind of building off what Paula said too, was about community-based doula services and midwifery services too. Can you talk a bit about what exactly those services are and why they're so important especially for communities of color?
Yeah, I mean, so, when we think about it, essentially, we're probably like folks who are coming from various different places, right? We have family members who live out of state. Maybe you don't have, a close community here where you are. So what does it mean then to have a support of someone who is offering emotional and physical support, as well as helping you to advocate for yourself during your birthing experience? Because it's a scary time, right? You're like trying to figure out all kinds of things. As a mom of, 6 children, I have, I've experienced various different things, like having a home birth, having to have to go to the hospital, and have a cesarean, and then having another home birth and having the rest of my children were born at home. But what does it mean for someone to know that they have access and they have options and they have it in a way that suits them, right? And really centers them. And so essentially, like, our work is centered in being able to provide a full spectrum of services, supporting individuals through their entire reproductive life course and what that looks like for them. Understanding, the historical implications of things as well. And so how people show up, they're not just showing up as in an episode of pregnancy, but they're showing up as their full selves with their cultural identity. So they're a complex individual. And what does it mean for us to be humble, right? And to really provide care from a humble place where you're actually learning from the patient, and you're centering what it is that they want for themselves in a way that feels affirming. So we don't advocate for folks. We provide them with information and education so that they can advocate for themselves. Mm-hmm. And it's not like this thing where we're like, oh yeah, we empower folks. It's like, no. We give you the tools so you can empower yourself, right? Understanding, like, based on where someone is, they may be experiencing something different. So, one of our doulas will come in. Again, these are people who live and work in the community. So folks know them, they trust them. They're like, you understand, right? You understand me. And they will provide in-home service. So like 3 to 4 prenatal visits at home, talking about fears and concerns, what to expect, how to prepare, finding you the proper resources that you need. They'll attend the birth and they'll be with them the entire time. And won't leave their side. Postpartum, they're going to come, if it's a home birth, they'll stay with them for a couple of hours, make sure they're settled as a family, come back and visit the next day, cook light meals, provide resources. What does it mean to center the parent so that they can focus on the child? There's so much emphasis a lot of times on, the woman being able to like, all right, come on, you got to get it back together, especially here in America, because they don't support what it means for you to rest, like, what does it mean for you to like really sit, to rest, to heal? Because, really and truly, it takes, about a year's time, or depending on the birth outcome, even longer for someone to heal and to feel centered, thinking about postpartum depression and anxiety and all of the other things that come up. We're in America, we don't have the infrastructure and the things in place, and especially in New York City, to really center someone. So when, someone's coming in with, say you just delivered, you had a cesarean, you're feeling like complications, you think something's wrong, you go back to the ER, they don't know what to do with you, right? They don't really have any kind of policies in place to be able to say like, well, what happens to somebody when they just had a baby and now they need to come back? And so the doula, also is acting as this like mediator between the institution and themselves to really connect them in a way so that they can get their needs met in immediacy. And the community-based doula, is powerful, is a powerful key to that. When we work with various different communities, refugee communities, undocumented persons, and, incarcerated pregnant people. And so like, what does it mean to understand that you're working with it in the intersections of care? Someone doesn't want to feel like I'm going to go to the hospital and someone's going to call ICE on me, right? And so, what does it mean to have that safety net that's created by community, where you can feel supported and uplifted and not feel like, you have to shy away from things? Because a lot of times we won't seek out services because of the things, some of the things that Paula mentioned. If you have money and you have resources, you can go wherever you want, you can do whatever you want. But when you're considered to be a person of color and you're low income, and on top of that, you may speak a different language, well, now there's a whole, slew of things that are happening at once. So what does it mean to have someone that looks like you, that speaks the same language as you, who can support you through your process? And again, because it's community driven and supported, it means that it has more sustainability, as opposed to someone coming from the outside and saying like, oh, this is what you need,
Right. Yeah, and I know that you all do such incredible work, and to really tackle these issues and address them head on. I've always been a little bit jealous that you've been in Brooklyn doing that work, because we do services out here in Queens, but it sounds like that may be changing while you were eating our amazing food yesterday in Elmhurst. So I just wanted to ask you a bit about that too. It sounds like your work may be expanding to Elmhurst.
Yes. So we are, super excited. I've been working on this like literally since 2010, trying to get into Elmhurst Hospital, and of course of like the bureaucracy and all kinds of things. But finally, I figured, the Most High makes everything happen in divine time. So it was the time. So I'm like, okay, cool, we're good. But yeah, we're going to be providing services, community-based services. So we're going to, we're getting in touch with community-based organizations in Queens, and we're going to seek to train, women in the community to be able to support, women and trust Elmhurst Hospital. As you mentioned earlier, Elmhurst became like the epicenter of COVID. And so, a lot of folks are hesitant to come back to Elmhurst, but they have a lot of things in place, and we really want to bring like the trust of the community back into the space, so folks don't feel like they have to go far in order to deliver their baby. They can get that support, again, that's supported by the community, folks that look like them. And so we're going to be really intentional about reaching out to folks, hosting town halls, and speaking to folks to like really see like, hey, what do you think about the maternity care and the reproductive health access services you have so far, and how can we help you to lift them up and to center the community in a way that feels affirming to you all. So I'm super, super excited about it because, you know, we have education. I get to talk to people. I mean, yeah, you know, Queens, I had a really, really amazing time yesterday. I was there all day. And a lot of our, you know, a lot of the work that we're doing too is from a reproductive justice, birth justice framework, but it's also understanding, you know, cultural identity and how that plays a role in how someone is seen. And so we're training the providers to be able to offer culturally humble care. What does it mean for you to have someone to come into this space? What does it mean for there to be more doctors of color in the space? Yep. Right? Given the population of Queens and the people that are there, so that they can feel like, okay, yeah, no, this is really, so it's not just an institution in a community, they become an extension of the community, you know, where they can feel like they can get all of those things at one time. So we're super excited about it.
Well, I am so excited too. I think Elmhurst really needs you all too and can benefit from your services too. So I'm so excited to hear this is happening. We'll have to find ways to partner together too, and work together on stuff, because it's, you know, coming out of this pandemic, it's like you said, two things happen at the right time, but especially coming out of this pandemic, I think it really highlighted how much our Elmhurst Hospital, a public safety net hospital, needs in culturally accessible, language accessible services, for a hospital that is really serving so many in our neighborhoods who don't have insurance, who don't have access to care. And Elmhurst is that first line of defense and needs all of our attention and support. So I'm so happy that y'all are there too. So yeah, more to come on that. Yeah. That's awesome. And Paula, I wanted to talk to you a bit too about, you had kind of, you know, talked about the framework itself of reproductive justice in our country, in Latin America. You've just come off an incredible campaign in Argentina, where you personally and your colleagues were on the front lines doing the work every day for a historic victory, which we were all following from here. Can you talk a little bit about that organizing campaign, and also what are the lessons that we as the United States and as New York City can draw from that?
Absolutely. I think that one of the biggest lessons is something also that Chanel was pointing out, and is that you cannot go and impose a movement. When we arrived, it was because the movement was already built, it was ready, and just needed the extra support to be in to get to the finish line. But it's a movement that has been working for over 10 years. It's called La Campaña Nacional por la Legalización del Aborto Seguro y Gratuito. And it's a movement that existed in a community-based kind of framework. They were like a small group of people who just got together all over Argentina. Argentina is the size of at least 5 to 6 states in the East Coast. Maybe that's how we put it, like kind of all the East Coast of the United States. And in every single city, in every single part, there was a group of women, mainly women, but then the movement expanded itself. But initially there were a group of women who were together and say, we need to change this. And they were just basic groups of organizing. We just get together and say, doesn't make sense. We need to do something about it. So we go and protest, and that's what we do. And then they start connecting each other, and they start saying, well, there is many of us. And then all of a sudden, it was a large organization. They became La Campaña, and they were saying, okay, we need to talk to people who were elected officials to listen to us. And that movement initially was a movement just that many people thought it wasn't going nowhere, because it was just like showing up every Thursday. That was the day. And they were just protest every Thursday in front of their own like city halls. And there just was a bunch of people. But all of a sudden, there was something that started happening. And it's the conversations about reproductive rights, reproductive justice. It started happening in the dining tables. It started happening in the size of the home. It stopped being a taboo issue. It stopped being something that you only talk with your feminist friends. It became something that you start bringing up in like family conversations and in your Christmases. And it's like, what is about with this? How is possible that so many women are dying? How is possible that I have access and somebody else in other city doesn't have access? How is possible that like so many other women are being harmed by this? And then the conversations became a social issue. And at that moment, something kind of magical happened, and is that the issue became mainstream. It stopped being an issue just of organizers. It stopped being an issue just of a few, but it became an issue of everybody. Everybody just got behind. And when the next 26th of November, is when we celebrate the International Day of Against Violence Against Women, one of the largest marches that we have seen in Buenos Aires took place. But this time, women were wearing the green pañuelo. It's like the green scarf as a symbol to ask for the liberalization of abortion. And it was just a magical moment because it was the first time that women from multiple generations, multiple social classes, multiple places, it was the grandmothers with the grandchild, it was just everybody just coming out to say, this is our moment to recognize that we have autonomy. And it was a beautiful discourse that happened in Argentina, and it was the connection of autonomy with democracy. We cannot really believe in a full democratic society if we believe that women are not able to make choices of their own bodies, if we still believe that the government and the state is the one who needs to control it. And I think that once those connections were made and people realized that really, if we want to live in an equal and democratic society, those decisions belong to anybody else but those who have their bodies, I think that everything changed in Argentina. So I think some of the biggest lessons that we can learn is that the movement started by organizing neighborhoods, and the importance of community organizing is something that it was key in this, and the importance to have the conversations at home. Just think, when you think that you are not doing something, but while you are challenging your grandfather beliefs into something, you actually are doing something. You are starting to mainstream those conversations. And I think that is just something that's important. But there was an extra factor, Shaker, and I think this is very relevant to you now that you are seeking to health office. And it was the courage of political leaders to actually come in the right side of history. And I think it made a difference when people who were elected in office and people who were seeking to elect office decide that they wanted to talk about this issue publicly. And there wasn't an issue that they were afraid, and there wasn't an issue that they were going to like pull away, but it was an issue that they were going to embrace. And I think that also changed definitely the discourse and everything that happened in Argentina. So President Fernandez decided to run in a platform which big issue was the legalization of abortion. And I am sure the many consultants told them that that was a wrong thing. And he just came out and said, it was like, for him, this was a social justice issue. It wasn't a women's issue, because also in Argentina, as it should happen everywhere, they were not only talking about women getting pregnant, but people getting pregnant, because we know that it's not only women, the only ones who get pregnant. But he came out and said, this is an issue about social justice, and we need to make it fundamental in our platform. And if we want to advance a society, this to be part of it. It was a big risk, but he got elected, and everybody in his party got elected. And I think the message this then is that politicians should not be afraid about talking about abortion, talking about reproductive justice, talking about women issues.
That was powerful. And I remember, we used to talk about it a lot during the campaign, but also just seeing too, that kind of courage. And it was courage really, as you said, because the movement was so organized in the streets and it was so grassroots, and it spread from there in a way where all of us were watching it too. And it was, and down to the wire, if I remember, every vote mattered and every elected was being held accountable. That's incredibly powerful, Paula. Thank you for sharing that with us too. And I see some questions also. I know I went a little bit long with our questions, but if you have questions, please either put them in the chat or send them to us too. Before, one question I see here, I see another one that's come up, and I wanted to just combine it with what Paula said too. So when it comes, Chanel, to what can city and state government do to better support your work, to better support organizations like Ancient Song Doula Services, but also to make sure that in particular, Black and Brown women have access to the services they need during perinatal services as well as postpartum. What can state and city government do to more effectively address these issues?
Yeah, one, we need better data collection. And so what does it mean to really what does it mean for us to really have better data and really start tracking maternal health care and the outcomes, because that is not something that is done on a regular basis. We do have the Maternal Mortality Review Board Committee, excuse me, that came out, and that was based on the pressure that has been going on around the nation to really start to address it. But it's not something that is consistent. It's not something that's like heavily monitored throughout the state. I think another thing is to really set up accountability measures. And so what does it really mean to be accountable to the communities that you serve? And really hold these institutions accountable for the work that they do. It's far time that people should not, what I realize is that a lot of the organizations or infrastructures, they get funnel all of this money with the same poor outcomes. What does it mean then to support community-based organizations that are out there in the communities who are doing the work in an effective way to develop capacity, to create sustainability, right? And divest from these institutions that are not doing the work in an equitable way. We need policies that are in place that really focus on the postpartum period as well, or actually the full spectrum of health, and understanding that it's all interconnected, because you could be pregnant, not be pregnant, right, at any given moment. And what does it mean to have the necessary supports in place? We need adequate Medicaid doula reimbursement, which is a big problem. The state put out a Medicaid pilot program, which we were involved in having conversations with folks, and it went nowhere really. All of the recommendations on how to really have an equitable model were completely disregarded. And so now you find that a lot of people haven't signed up to it because they're like, why would I do this?
Right.
And so, where state is really starting to listen to community-based approaches to care. And what does that mean? Because community knows best, as opposed to, again, this like hierarchy of care and saying, oh, this is what they need, right? You know what I mean? Which never works, right? And we've seen that time and time again with all of the different campaigns that they put out, and then they're like, oh, my bad, I didn't know that
Exactly.
wasn't gonna work, right? So, yeah, we just need, we need an infrastructure that thinks about, there's no diaper bank here in New York City. There's no place where, if you happen to be undocumented, where you can get like formula or things of that nature if you happen to need it. Like, why don't we have those things?
Right.
So starting to think about, infrastructure as well, and really setting it up so that there's sustainability, there's community, it's community focused and oriented. And we have offices, all these different coalitions and things that come together, but what does it mean to like really center the voices and do the work and create what needs to be done, and not just talk.
So
Shaker, if I might jump here, there are two things that Chanel just mentioned I think super important, but we saw it during the pandemic. One of the biggest requests, at least I got even in Spanish, was formula and diapers. Like, people really need them. It is a huge thing. It is so expensive and it's so hard for our communities. And also in New York City, we have very beautiful laws, but many of those laws have not become reality for many communities. And I see that in Queens very vividly. There is still a cultural barrier that needs to be kind of break in a sense. And it's not only about translating and making it accessible in Spanish. So you have in Spanish, that's it, right? What else do you need to do? Is actually to be able to work with the communities to explain what it means to be able, for instance, to have an abortion fund. What does it mean? Because it's so far from our reality in many of our countries that just having the version in Spanish is not enough. So when we talk about language accessibility, we are not only talking about translation services, but we are talking about cultural accessibility as well. And I think that is a component that New York City is missing. So we have beautiful laws in place, but there is still not that transfer to some of the communities that need it the most.
And it's so, shocking, but it's like these are fundamental issues, right, Paula? On the one hand, like you talked about, cultural accessibility being not just translation, but addressing cultural stigmas, concerns in your language, but addressing them in ways that, you know, our communities will understand them and can overcome whatever concerns or stigmas they have. But it's also, to your point, you know, Chanel, too, and what Paula mentioned as well, a diaper bank, how we don't have that, or how, you know, the need for formula is so great.
Right.
But especially, you know, for communities like ours too, there's no access to formula, and the city doesn't actually help with those things. Too, like you said, data and tracking those things.
Right.
It's really shocking how basic these issues are in terms of how lacking New York City is when it comes to these services.
Mm-hmm.
And that was a beautiful lesson learned from Argentina and to many countries. One of the reasons why Argentina was successful is because we had the data. So we were able to use the data to launch a campaign afterwards to say what was missing. But without the data, it's just, you're kind of talking like no sense, you know? So it's just really key.
And people don't understand that without the data, how serious the problem is, right?
Yes,
Right.
absolutely.
I see one question here too, a couple questions, but one about, can either of you talk about unnecessary C-sections and what drives those, the pressures to have C-sections, and how has that come up in both of your work too?
Yeah, I mean, it could be a multitude of varying different reasons. Some of it is based on, you know, if someone has had a prior cesarean initial one, and, you know, here in New York City, we hardly have any VBAC doctors, like, so doctors who are willing to perform a VBAC on someone. So then they might be subsequent to another cesarean section. If you can't get a hold of maybe a home birth midwife who's willing to support you through your process, which, you know, really makes it slim for people that really have access to be able to do that. But then it's also about the education around ways to avoid one. And so, you know, if you go to the hospital too early, you know, the hospital is a business, you know, at the end of the day, they need you in and they need you out. And so if you go too early, they're going to send you home. If you go right in the middle, then they're going to keep you. But if you don't progress in enough time, then they're going to start medical interventions that can possibly lead to a cesarean, you know? And so, you know, some of it is that, some of it is having access to doctors who are willing to open their minds up to, you know, something that is removed from the medical model of care, and looking more towards, you know, having midwives. You know, people sometimes think like, oh yeah, there's midwives, and it's like, no, not so much, right? There's a shortage of hospital-based midwives. A lot of, you know, care, if you think about care in other countries, a lot of it is driven by midwives. Right, exactly. And OBs come in only if there's an emergency of some sort. And if we had frameworks that more centered, like, you know, a midwifery model of care, where you're really looking at, you know, the whole person, you're understanding the natural physiological process of birthing, I think we would have better outcomes as well, and fewer cesarean sections, as opposed to, you know, some of it's for basic stuff. You have twins, you might end up with a cesarean. You know, if you have a breech, you know, you're gonna end up with a cesarean, because no one knows how to, you know, do breech deliveries anymore, right? But if you have midwives who are on staff, who are trained to be able to hold and to, you know, to handle that kind of care, then you wouldn't have that as much. So yeah, it's you know, the infrastructure in terms of maternity care within New York City as a whole needs to be upgraded. You know, we talk about gender-based violence, you know, that's another form of violence that happens in the birth room. You know, there's a lot of things that are happening, like obstetric violence, where people are being forced to have medical procedures that they don't want, you know, and then, you know, other systems are used as tools, as fear-based coercion, to get them to comply with a medical procedure. So it's really important for us to start to have these conversations and really hold these systems accountable to the ways in which they treat us.
Paula, did you want to?
I just wanted to add the obstetric violence is also a huge issue in Latin America, and it happens most commonly, and even here, to women of color. And that's just the reality of it. There is so much stigma, and there is so much prejudice, and like there is so much racism that goes into the system that is just really very heavy. I have worked collecting stories of women who have suffered obstetric violence, and it's just really heartbreaking. An experience that should be beautiful becomes a very traumatic and an awful experience, and that is something that it needs to change, but it requires the intentional work to addressing it, to talk about it, because we don't even talk about it, right? It's just something it's like so many things about the entire reproductive process that we just don't talk about it. Please don't start me with everything that they don't tell you about postpartum, because that is like a whole I think that we will have an entire new section and you check up about that. But and I am a woman who was working on this issue, and I had no idea of what was expecting on the other side. But we really romanticize so much the idea of maternity that we forget to talk about all the other things. And it's important to really address them, to really talk about it. So I think I appreciate a lot this conversation, because it's just a very honest conversation about this issue, and I think that is just the first step to be able to address some of these issues.
And I do have another question too. I did actually, you're right. We've touched on postpartum a bit, but it's a whole separate topic. But I did want to talk about that. But just before that, one thing that you said, Chanel, too, which was, you powerfully captured it, just the way in which you go. It's so formulaic at the hospital, right? When you go, it's like, it's too early, so you'll send you back, or we'll talk about maybe, Pitocin at some point, or from there, like, it's maybe it'll become a C-section. It's just such a rigid march one way or another towards outcomes, rather than listening to patients too. So one thing that I had a question about was, you talked about midwives and how important they are in really providing care and listening to birthing people too. It sounds like one that would be really important would be to expand the number of midwifery-led birthing centers in our city, right?
Oh, yes, for sure. I mean, again, we went from a city that had about 5. And when, since I've lived here, I've only known of 2. And I know when I first, when I have identical twin daughters, and I had them in the hospital. And when I had them, that hospital actually, right after I had them, they closed. And that was St. Vincent's Hospital, which is on 14th and West 4th. Right. And it was down that way on the west side. And so and it had closed, and that was one of the birthing centers. And then they had Mount Sinai West and Columbus Circle that was open, and then Brooklyn Birthing Center. And Mount Sinai West you couldn't get in there if you weren't of a certain economic bracket. Like, they didn't take Medicaid patients at all. They closed about a year ago, right before the pandemic. So I would say at the top of the pandemic, I believe they closed, or in 2019. And then Brooklyn Birthing Center was there. And then they opened up during the pandemic, the birth center that's in Manhattan, which is Jazz Birth Center. And they opened it up to be able to give an alternative for folks to be able to access, care, because folks were afraid to go to the hospital. And now they're closed. They've closed the one in Brooklyn, and now they only have the new one that's in Manhattan, which becomes problematic, right? Everybody's not going to travel to Manhattan.
Of course.
People may not feel comfortable. You know what I mean? It's not in their community. They may feel like, is this really for me? And so, thinking about that in ways in which, we really need to expand birthing centers. There's, organizations that are trying to get birthing centers in the Bronx. Wow. But we need one in every borough, really, really and truly. We need to have one in every borough, and we need to have access to midwifery. And so, here, CNMs are able to practice, certified nurse midwives, but CPMs are not, certified professional midwives are not allowed to practice. If we opened up the pathway for CPMs to be able to practice, we'd have a lot more midwives to assist in building up the infrastructure and supporting communities. So, there's a lot of things that needs to be done. and really being able to support community. But birthing centers are an amazing way to be able to do that. You know what I mean? And so just think about it. Think about a birth center, and you know, and the hope is that through Elmhurst, you know, and I'm thinking big. I'm thinking big.
That's good. We need to think big.
I'm thinking big. I'm like, you know, the hope is that through Elmhurst, we'll be able to have like a birthing center model in that space. And so,
Wow.
you know, we've ordered birth balls and different tools to be able to use in the room. And, you know, so folks can be able to walk around, they can eat, they can drink, they can do all of the things that we know, you know, work. Paula's like, yes.
Wow. Yeah, absolutely.
Absolutely.
Yeah,
and I hope, Shaker, that you will become an advocate for this idea.
I'm thinking those right now. I'm like, this is incredible. Now my mind is like, I'm seeing all these things too. I'm like, wow, this would be awesome to have here at Elmhurst Hospital. I'm so needed.
Yeah. So, and you know what it really is going to take? It's going to take pressure from the community. It's going to take community to say, like, we want this, we need this, this is necessary, not for our, you know, so we can, you know, not just survive, but so that we can thrive. You know, one of the biggest moments in someone's life is like, you know, birth. You know what I mean? And how we choose to center birthing people is essential. You know what I mean? It's a catalyst for how their postpartum period is going to go, how they see themselves as a parent. It's an extension of the community as well. You know what I mean? How do you feel in navigating spaces within your community after that? And so, like, you know, I always tell folks, it's not a one-time event. Like, we think like, oh yeah, you just had that baby. Like, okay, great. No, it's like, no. This child is going to grow up in this community. How we choose to center that parent so that they can raise that child is important. And so, yeah, so like, we can talk about this birth center and put
I know. This is part one of the conversation. What conversation to have on this issue? And you know, you bring up a good point, and I feel like, you know, I know we're coming close to the end here, but I do want to at least ask, you know, one specific question about, you know, postpartum too, because that's a whole separate conversation where there's so much need there too. But you know, one of the things that I even see, just as a father, I saw it, and obviously you both, and you know, all other people know it so much better than I can express so much better than I can. But I've seen the way in which there's so many things that just aren't talked about, you know, postpartum too. So breastfeeding itself too, the difficulties of breastfeeding, or breastfeeding versus formula, and the stigmas around each of those things, and how, you know, to, as you mentioned before, Chanel, as well, the lack of follow-up care for birthing people, you know, postpartum too, and how scary that is. One aspect of it is mental health care for birthing people, and how we make sure that we're actually addressing the mental health of those who have just given birth. And so I just ask you both, you know, what can we do as a city, as government, to really make sure there are services, especially postpartum, when it comes to mental health?
Yeah, I mean, I think, you know, first and foremost, mental health in the postpartum period is super, super important. You know, you're going through a fluctuation of like hormone shifts. You're feeling certain ways, your body is changing, you know, how you see yourself, all those different things. And if you were already, you know, experiencing prior to pregnancy, you know, anxiety, depression, mania, any of those things, you know, those can be, you know, exasperated during the postpartum period. And, you know, a family member or somebody might see it as like, oh, they're just freaking out. You know, there's nothing wrong with them. Oh, that's normal, blah, 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 blah. And really like not understand that the person who is experiencing it is really going through a myriad of different emotions and feelings at the same time. And so what they really need is support that's grounded in love, is centered in care, you know, and understanding like what you're experiencing is completely normal. Right. Yeah. And having those necessary supports in place. So like being able to do that though, without fear of reprisal for doing it, is super important, right? Because we like to tell people of color, like, seek out care, go tell somebody something, but then they'll go to you know, not necessarily like vetting the place where they go, right? And understanding like some places are mandated reporters. And if someone doesn't understand like various different cultural identities, if someone doesn't understand like religious, you know, beliefs around certain, you know, customs and things of that nature, when it comes to the postpartum period, they may not understand why someone is doing something, right? Or why they aren't seeking out care. And so being able to have providers, mental health providers that, you know, again, look like people that are culturally congruent, where, you know, it's free from, you know, reprisal if they, you know, refuse something, or they share an intimate story, you know what I mean? And really working from a harm reduction perspective, you know what I mean? Like, what does it mean to like really center a harm reduction model where people feel centered in their care? And I say postpartum is forever. Like postpartum never stops.
I am hoping they will stop eventually. But just to
6
add
kids
to
later,
things,
Chanel say this, Paula.
I know.
Right.
Just to add to
I'm
things,
being real.
I think that real conversations are fundamental, because I think that many women and many people get into the process without really understanding everything. And I went through the process, and I keep asking questions, but the answers were very like vague, or they were not good enough. There was like, oh, they sent me a book, and I was like, you really pretend me to read this book this large? Like, I was trying to say, what can I expect, right? And I think that there is just such a lack of there is so much stigma that then we don't talk about it. There's such a lack of conversation about what can you experience, what can you feel, like everything that comes to it, and especially in the first weeks, they're just so hard for everybody. And I think that we just need to be able to have those conversations. But also on the other side, and I am not advocating for overregulated by any means, because I am opposing that, but at least some minimal follow-up. Like, I travel outside the United States during the COVID, and I have received 5 calls, automatic calls, to see what is my follow-up status, if I have fever, if I have symptoms, because I travel. I give birth and nobody follow up with me to see if I was still alive. You know, so I think there has to be like a minimal sense of like, hey, are you okay? How are you feeling? Let's have a real conversation. You just have one doctor appointment afterwards in which everything is still blurry, where you barely are like a person yet. But so there has to be a mix. And I think that an idea will be that follow-up will not be from an authority, but it will be from a community-based kind of environment or organization that comes to you and say, hey, how are you feeling? Do you want to talk about it? Because right now it's just so much going on. And I think that those type of services that the city can provide, can sponsor and support the work of community-based organizations for them to do that work. And I think that will be a system that definitely will help many mothers in the postpartum period that currently never ends.
The permanent postpartum.
You'll be all right. You're going to be okay.
Okay, thank you.
I don't know if Paula was ready for that realness, Chanel.
I know. I was like,
Well, I have to say, I know it got a little bit late, but I was just so enjoying the conversation so much too. Really admire you both so much for the incredible and incredibly important work you're both doing every day too. So thank you so much for this conversation. It's not nearly enough. There's so many more topics that we could have covered and gone more into depth onto, but I'm so grateful to you both for coming on tonight too and talking about these important issues. I hope of many more conversations to come too. I know, Chanel, you and I need to keep talking too, for sure.
And thank you, Shaker, for having this conversation. I think that is important.
Absolutely. And I think that, you know, it's more conversations like these need to keep happening, like you said, to break down barriers and stigmas too. So I want to say thank you so much. And Chanel, hopefully we'll meet sometime. We'll meet here in Elmhurst for good food too, to talk about these issues at Elmhurst Hospital as well. We'll have Paula, who's in Astoria, to come over too. So
absolutely.
Thank you so much, everyone. Really enjoyed it. Thanks for coming out today, everyone. Have a good night. Talk soon.
Bye.
Bye.
Bye.